Okay, hi guys. So I'm still at Trail Guide to the Body. Again, still at the forearm and hand. So I'm at page 140 this time. So I'm gonna be presenting flexors of the wrist and fingers. So please look at the image here. This is the anterior view of the right forearm. As you can see, the image here, and anterior meaning is the palmar view, right? Palmar, dorsal side, palmar, dorsal. Okay, so we have established that. Please look at the image here. So we have all these muscles involved, and we're in flexors of the wrist and fingers. Okay, we have the flexor carpi radialis, we have the palmaris longus, we have flexor carpi ulnaris, we also have flexor digitorum superficialis, and we have flexor digitorum profundus. Okay, so the 5 flexors included in this section create flexion primarily at the wrist or fingers. So they are located on the forearm's anterior or medial surface between the brachioradialis and the ulnar shaft. Most of the flexors originate as one mass from the common flexor tendon at the medial epicondyle of the humerus. So the bellies of the flexors extend down to the forearm, becoming thin tendons roughly 2 inches proximal to the wrist. So as a group, the flexors are thicker and more pliable than the extensors. Although the flexors are easily accessed as a group, isolating specific muscles' bellies can be challenging. So the flexors are arranged in 3 layers. The superficial layer is formed by the long bellies of flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. So flexor carpi radialis is medial to the pronator teres and brachioradialis, whereas flexor carpi ulnaris, it lies close to the ulnar shaft and has a distinct tendon attaching to the pisiform. The palmaris longus, which is sometimes absent, runs between flexor carpi radialis and flexor carpi ulnaris and attaches, so my apologies and thank you for understanding, and attaches to the palmar aponeurosis, right? It attaches here to the palmar aponeurosis, okay? Portions of all 3 muscles can be isolated for palpation purposes. So we're going to be dealing with the palpation later on and the accessing of these muscles individually. Okay, so the medial and deep layers contain the wide bellies of flexor digitorum superficialis and flexor digitorum profundus, respectively. So each digitorum muscle has 4 thin tendons which pass through the carpal tunnel and attach at the phalanges. The bellies of the digitorum are difficult to access directly, but their density can be felt between the superficialis flexor. As you can see the image here, where the medial view of the right forearm with fingers showing order of muscles. This is the medial epicondyle, right? Whereas the index finger of the therapist is on the pronator teres, and the middle finger of the therapist is on the flexor carpi ulnaris, and the palmaris longus is on the 4th digits, and the 5th digits is on the flexor carpi ulnaris. Okay, see you guys in the next video.